What is chronic disease? This is defined by medicinenet.com. Chronic disease is a non-viral, non-infectious disease, though you will see a lot of research searching for viruses and infections. I usually work with MS, and they're constantly looking for what infection or virus might have caused it. It lasts more than 3 months, and this is according to MedicineNet. It cannot be cured by medicine. These are examples. You have the autoimmune disorders like arthritis and lupus. You have cardiovascular diseases like heart disease and strokes. You have cancers like breast and colon, diabetes, Parkinson's, and all the chronic pain. Now, let's go a little deeper. According to functional medicine began in 1990. Functional medicine is all about focusing on chronic, because we're really good at acute. But the problem is, medicine has treated chronic mostly as acute. And so functional medicine first begins with separating the two. So when you have acute disease, you're in the middle of a heart attack, it's something of short duration, it's usually traumatic, and it needs urgent care to isolate that symptom, or else the patient will die. So acute disease works, and it has to be isolated. It's the symptom. Make sure the symptom doesn't kill the client, right, the patient. But once that stage is done and the illness has been there for more than 3 months, it is considered chronic. And once it is chronic, we need to stop treating the symptom. We need to begin treating the lifestyle. We need to begin treating personally the whole person. And we need to treat that whole person based on their unique environment, their unique lifestyle, their experiences, and their genes for those 2 to 5%. So, how do they treat it? Just going a little further. When it's acute, symptom treatment. Get it out. When it becomes chronic, there are 2 aspects that need to be treated. You cannot ignore either of the 2. The first is the physiological factors. Treat the nutrition, detox the client, genes, exercise. The most powerful treatment is having power partners. So as a hypnotherapist, you'll mainly be working on the psychosocial, and I'll talk about those. You can help with the physiological and making sure that they do the things they need to do and are motivated to do it. But to really create change, you need to address both. So our area of focus will be the psychosocial factors. I call them mental patterns, and we'll get more in detail what those are. These are the big traumas. These are also the little traumas. Being ignored as a child is this trauma that's detrimental. The ACE, early, adverse childhood experiences. Emotional repression is very big with chronic disease. And insecure attachment styles, codependencies. All right, so this is Gabor Mate. He's Canadian. He has a great book, which I'll be reading in a little while, called When the Body Says No. All the, let's say, evidence-based research of everything I'm talking about is here. This is quite a good book, which is demonstrating the key psychosocial factors of any of the diseases. So he says, yes, cancer, multiple sclerosis, rheumatoid arthritis, and other conditions we examined are not abrupt new developments in adult life. You get a cancer, don't just look at your last 6 months. They are the culmination of a lifelong process. My clients with multiple sclerosis were working on the last stressful events, which were the determinant trigger, but we need to then work on the 3-year-old. So, what is chronic disease? When someone comes in with chronic disease, look, see if they're doing exercise, check nutrition, but go up into the mind. There's an overload up there that needs to be healed.